describe.
Thank you very much. My name is David Grube. I'm a retired family physician from Oregon. I practiced in a small town Oregon for 35 years. I did prescribe lethal medications for a few patients and know quite a bit about this subject. So the process is, I know my patient very, very well, and we have talked about this as they've gone through their disease process. These are not people that are, there's not much question. They're very, very sick people near the end of their life. They come to me, I get a psychiatric evaluation. If I feel that they are incompetent, I need then to find another doctor. This is very similar to what the proposal for 128 would be. That other doctor then also needs to review the medical records, do a physical examination on the patient, understand if they're mentally capable or not, and then the two of us must agree on that. Then a written request comes from the patient. There's a period of time for waiting, it's 15 days, and then the patient can request the medication. Medication can be prescribed, and then there's still another waiting period. At each of these steps, we need to ask the patient, do you understand what the medicine would do for you? Do you understand that this would be a life-ending medication? You understand that you are to make this decision on your own? I think that makes it, some of the concerns that were expressed in testimony not really very valid, because at each of these steps we have asked those questions, and there's no coercion. I don't listen to the sister or the daughter or a caregiver. I'm speaking with the person. If the person does not seem competent, and I would get a referral, or I would say we're not going to go any further. And at that time, then, after all of those things have been done, the patient may pick up the prescription, and then it's their choice whether ever to take it or not. And as you heard testimony, in Oregon, and this is also my own personal practice experience, only 2/3 of the patients ever end up taking the medication. But because they have the power to make the choice, it's very reassuring and comforting for them. Another way of making them feel better.
No, there's no,
This is not an open forum.
this is not a debate or a discussion. These are only questions allowed by the members at this time. If a member asks you a question, then you're allowed to respond. Any other questions or comments from any of the members?
Yes, Mr. Chair, I have another question. So there is no elder abuse in this process, right? Because I heard testimony earlier that said that it would open up Pandora's box for elderly abuse. You did say that the influence would not come from a cousin or a daughter or son, et cetera, et cetera. It's a decision made by the patient and that patient's doctor and caregivers, psychologists, psychiatrists, et cetera, correct?
That's absolutely correct. In Oregon, it is the individual's choice, and they are the one with the autonomy. I may not want it for them, the sister, the brother, the caregiver may not want it, but as a responsible physician, I need to speak with the patient. I need to make sure they're competent, and I've had consultation with a psychiatrist or a consulting doctor. And if that's all there, and I do this on repeated occasions according to the statute, there isn't elder abuse, and it doesn't happen.
Mr. Chair, could I just address also on that question as joint author? The proposed bill in front of you provides a further safeguard that would require the attending physician to meet privately with the patient without any caregiver, relative as part in formulating their evaluation of the patient.
And
Yes, Senator, oh, go ahead.
and the issue of coercion is called out in the bill as something that the doctors, the attending, the consultant need to look at. That's called out.
Senator Mitchell, question or comments?
A question, sir, directed to the physician. Currently here in the state of California, it is at least practice that emergency room physicians, particularly if you're admitted or in the hospital, all health personnel will ask you if you have an advance directive. And so it's really the healthcare provider initiates that conversation. They will ask if you have a do not resuscitate order on file. If passed in California or in your own practice in Oregon, how is this option communicated? Is it communicated as a part of an advance directive, kind of general conversation, regardless of what I present in the ER-4, I'm given all of this information? How do people know that it's an option?
Thank you for that question. It's a very good question. Of course, it's individualized, and the wonderful thing about advance directives is it's patient self-determination, that they are allowed to have each of the options reviewed and be given complete informed consent. This could be part of the conversation. If it was complete informed consent, it would be part of the conversation. It may not be part of the conversation at an initial visit, but these people are generally people who have been being seen by doctors for a long time because they're very near the end of their life.
I don't know if it's the case, if I may, Mr. Chair. I've seen a variety of actual forms. Various hospitals, have an actual booklet that you can go through that provides questions that are very helpful, I think, to initiate, as someone mentioned, the importance of proactively having these kinds of conversations with family and loved ones, hopefully prior to the time where you have to take action. And so would it be a part of, in Oregon, do you have pre-printed advance directive forms that this is listed on?
I have not seen those.
Okay,
No.
thank you.
I'll allow the Senator Woke to
It's
perhaps a
important
question or
to
answer.
understand that one of the safeguards is that, in fact, advance directives do not apply in this law. This has to be initiated by the patient. Advance directives could be, I hope everybody in this room, no matter what your age, you have an advance directive, which is very general, but this is very, very specific to end-stage terminal illness, and it has to be initiated by the long process has to be initiated by the patient.
And
It's not being promoted, it's not being promoted in any way.
And it can't be honored if it's in an advance directive and the patient is not competent. In other words, you can't anticipate in the event that I have a terminal illness, but I'm no longer with it, this is my wish. What the law provides is that we can, in an advance directive, ask for the end of medical support with a do not resuscitate or do not artificially feed, which may go counter to some of the statements made by some of the physicians that their duty is to maintain life regardless of the patient's circumstance, because we have existing law in California where a patient's autonomy and advance directive can direct a physician not to extend life. But we would not allow in the implementation of this law for something that requires real-time consultation between doctor and patient and potentially psychiatrist or psychologist can only happen in real time.
Thank you very much.
Thank you. Questions, comments from any of the members? Yes, Senator Nielsen.
Yes, I guess to the proponents, is it expected that California health plans will provide and cover the cost of the lethal dose?
It's a great question. In our research in Oregon and our preliminary research in California, it would not mandate a health plan to cover it. In Oregon, some health plans may cover some, if not all of the cost. We all have very different plans with deductibles, co-pays, et cetera. What our bill does say is that a health plan can't discriminate against somebody in denying care by coercing them to exercise an end-of-life option.
No, slow down on it. The health plan can't coerce someone
That's correct.
to
use
accept
it,
that.
to accept
Okay,
this option.
I got that. All right, I understand.
Right,
So,
And Senator Nielsen, Medicare does not cover it
yeah, it is not covered then.
by Medicare.
Okay.
Senator Pan, question, comment?
I actually appreciate the discussion. I understand our bioethicist here was going to make a comment. I'd like to hear what he wanted to say.
Of referring for psychiatric consultation to assess the patient's capacity, but there's issues that go beyond whether the patient has capacity to make a decision that contribute to suicidal thinking. Most suicidal thinking, as I said, is driven by depression, anxiety, other mental disorders. These things can be subtle at times, and not all physicians are qualified to assess them. So the fact that a patient can go to a physician that they don't have any prior relationship with, ask for this, get a referral to another physician that they don't have any prior relationship with, and within 30 days, get a prescription to end their life without necessarily having a full-scale evaluation either for competency or, more importantly, for mental health concerns, I think shows that there are insufficient safeguards in this law to protect people that have treatable conditions and people who would make different decisions if they had different medical care in place.
Mr. Chair, might I address that question as well through the chair? Thank you for the question, Dr. Pan, and for the informed answer of the doctor who just spoke. I do think it's important when we utilize the word suicide to recognize that it's not just playing with words, that we have the American Public Health Association saying medical and legal experts have recognized that the term suicide or assisted suicide is inappropriate when discussing the choice of a mentally competent, terminally ill patient to seek medications that he or she could consume to bring about a peaceful and dignified transition. And the American Academy of Hospice and Palliative Medicine, this is the academy whose focus and expertise is end-of-life care. The term physician-assisted death is utilized in this document with the belief that it captures the essence of the process in a more accurately descriptive fashion than the more emotionally charged designation of physician-assisted suicide. And I think one thing that's dangerous when we hear a mix of suicide data that doesn't relate to terminally ill patients, the notion that somebody whose death is predetermined not through their choice, but through a medical diagnosis and a disease for which there is no cure, to suggest that they just need good counseling to be mentally robust and to accept that end of life and to take away self-determination or autonomy, we would take exception with that.
And if I may just add, Mr. Chair, the California Psychological Association is in support of this bill. We are expecting a letter. Their board has taken action, and the California Psychiatric Association has a recommendation of neutrality, which is going to their board. And those are the conversations directly related to suicide and assessing depression, which this bill does allow for, should the physician, the attending physician, or the consulting physician notice a symptom like that.
That's part of their standard
That's part of their
care.
part of their standard of care. Thank you.
Thank you. Comments, questions? Senator Hall?
Yes, thank you. The lady here, ma'am, what is your name?
Hello, Senator.
Hi.
Christy O'Donnell, and I'm here with my daughter, Bailey Donarovich.
Ms. O'Donnell, my prayers are with you and your family.
Thank you so much. You and many other people have been praying for me, and
Thank
that is
you.
appreciated.
You're an attorney. Did I hear you say you're an attorney?
Yes,
Yes, and you have you are very you articulated yourself appropriately and with clarity, and it appears that you're of sound mind. And what do you say to certain folk who say that folks who are making decisions for this process are not in sound mind to do that? But it appears to me that you are of sound mind, educated, and very articulate.
thank you. Very kind words, Senator, and I appreciate that. What I would say in response to that on this particular topic is before becoming an attorney, I was with LAPD as an officer, a detective investigating crimes, and then a sergeant. I actually was on the line in the street, going into people's homes and actually enforcing the laws in the state of California. With respect to the mental competency issue, for example, there is history and precedent in the state of California for making these types of decisions. For example, Welfare and Institutions Code 5150, the California statute has granted a very low-level police officer who could be 21 years old with absolutely no life experience to make a determination about a person's life, their liberty, and actually incarcerate them for a minimum period of 72 hours or more. That's a much lower level, clearly, than these types of decisions that not only one physician is evaluating, but two physicians. It's also been my non-expert opinion, solely based on the perhaps 8,000 calls going into people's homes all over Los Angeles, that these suicidal patients, where I stood in their homes, both as a sergeant, a detective investigating the felonies under the penal code, and the officers, that the investigations that are done in the state of California, there are already a plethora of laws to cover all of your concerns with respect to the potential abuses of this particular law. We have elder abuse laws, which I investigated as a detective, a lot of elder abuse laws. We have laws, for example, that investigate attempted murders. We have laws, both civil and criminal, that investigate abuses against disabled adults, children, and otherwise. So I would say to you, in my very humble way, that the laws in the state of California that you have already enacted as senators and those that have come before you should provide the appropriate prophylactics for this particular law. And for this law, for those of us who are adults, deemed mentally competent, and given less than 6 months to live with a terminal illness, it is not just the physical pain, the emotional pain, that the benefits in this particular case outweigh the negatives.
Thank you. Thank you, Mr. Chair.
Thank you. Questions, comments? Seeing no questions or comments at this time, we're going to ask for any other support or opposition. If you don't mind, all those up here in the dais, we'll ask you to go back to have your seat. So there is a, let's do everyone in support first. Everyone in support first. There is a mic on the left-hand side. Let's hold on, let's make sure, hold on. We're not going to start quite yet. We're going to make sure everybody gets down.
Can I get some help from somebody? My control box was jammed up against this member under the table. I need the table to come up to let me out. And
Can
my
you help to lift the table? It's caught. Yeah, it's caught under.
No, what you don't understand is my wheelchair might be broken because
Somebody then needs to hold it while we call this up.
my wheelchair might be broken. Let me let it freely in for a second. I hope that works. I think you can pull me back now.
Yeah, just
pull me back now.
Okay.
Look at this. Look at this. Look at this. Look at what happened.
Oh, you broke it.
I was moving to let her lie, and there's this wooden member here. Oh, well, this is, well, let me, wait a minute, I may be able to suggest that it can work. That's fair. Don't touch any button. Because if you circuit, I may not be able to work.
I don't know, we may end up voting. He keeps it, he's going to just, thank you. He'd love to stay.
I love it too. You know, Martin Buber wrote a book called The Eclipse of God.
One of my favorites. Yes.
Can I ask, he's going to go first in support.
Okay, we're going to go ahead and get started with support first. I ask that you just state your name, if you represent someone, and your position. We're going to start here, and then we'll move to the microphone over there.
My name is Dan Diaz. I am Brittany Menard's husband, and I'm in support of SB 128.
Thank you. We're going to move to the microphone. Again, name and position only.
Gary Passmore, Vice President of the Congress of California Seniors who fight elder abuse every day, and we're in strong support.
Thank you.
My name is Alexis Weiser. I am a senior senator at the California Senior Legislature. I am here today on their behalf. The California Senior Legislature supports this bill. Thank you.
Thank you.
Hello, my name is Tony Broaddus. I am the California Campaign Director for Compassion and Choices, and on behalf of Compassion and Choices, we strongly support SB 128. Thank you.
Hello, my name is Dr. Sarah Pender. I represent several categories: senior citizens, Catholics, licensed clinical psychologists at medical hospitals for over 40 years, marriage family therapists, and a bereavement coordinator at hospice. And I have attended numerous deaths, and I deeply support your giving this choice to the people in California.
Thank you.
Hello, my name is Dr. Usha Sankara. I'm a Johns Hopkins trained medical oncologist and hematologist, and I'm here today to give my voice of strong support for SB 128.
Thank you.
My name is Dolores Itel. I'm a nurse. I've practiced over 55 years. I'm a nurse practitioner. I worked with Carol Ann Quinlan's case at the request of the governor, and I have taken care of thousands and thousands of patients who have grabbed my arm.
Position only. Position only.
Okay, that's it, I guess.
Thank you.
Lots of experience.
Thank you.
John Lynch, I live in Half Moon Bay, Cemetery County, coastside. I got involved in collecting signatures the first of the year. In 3 months, I got...
Position only. Support or opposition?
Definitely support.
Thank you.
And I got over 3,000 signatures in 3 months. And guess what? I only have 151
Thank you.
Didn't support.
Thank you.
Thank you.
Patricia Portillo, I support SB 128. Soy Patricia Portillo y apoyo la propuesta 128.
Thank you.
My name is Jenny Johnson. I support SB 128.
Thank you.
Chair and members, Sean South on behalf of the California Primary Care Association in strong support.
Thank you.
Minga Futural, a citizen. My husband's been diagnosed with a fatal brain disease. I strongly support Senate Bill 128.
Thank you.
Kathy Van Osten, MBM Strategy Group, representing AIDS Healthcare Foundation, in strong support of the bill.
I'm Helen Thompson, former member of the legislature and the Assembly Chair of Health Committee, working on these issues for many years and very proud of the two authors of this bill. I represent today Patty Berg, who's the honorary chair, and over 80 former Assembly members and senators who have signed on to support this bill. We urge your aye vote.
Thank you.
Phyllis Shankman. I'm an LCSW, a licensed clinical social worker, and the former executive director of an AIDS counseling center, and I support this bill fully.
Timothy Kreck, completely supporting this bill and Bill's work on it. Thank you.
Hi, I'm Jerry Garber. I'm from San Francisco, and in memory of my Aunt Lois, who starved herself for 33 days, I support this bill.
Thank you.
I'm Doreen Cotter from San Francisco and support Compassion and Choices because my eldest son died of a brain tumor, entered hospice, and also starved himself to death to hasten his death.
I'm Jan Neufeld. I'm a San Francisco Healthy senior resident, and I strongly support this bill.
Thank you.
Danielle Quillisi, and I strongly support this bill.
Sylvia Solis Shaw on behalf of Los Angeles City Attorney Mike Buer in strong support.
Anyone else in support?
My name is Bob Peasley. I'm a 75-year-old man who hopes to have some choices when he's ready to die.
Daniel Oakenfuss on behalf of Insurance Commissioner Dave Jones in strong support.
Thank you. Vincent J. Patty, social worker, psychotherapist, disabled. I strongly support
Thank you.
SB 128. Thank you.
Good afternoon, Dr. Rose Kowaleski. I'm a pharmacist, medical researcher, and bioethicist, and I strongly support SB 128. Thank you.
My name is Billy Thrower. I am a terminally ill cancer patient. I fully support SB 128, and I beg you to.
Thank you.
Jean Jackman, I fully support, and bravo to the co-authors. Thank you.
John Mott Smith, I'm here representing my family, my parents, and my children, and I strongly support the bill, and I also thank the authors.
I'm Rachel Harrington, representing the Secular Coalition for California, and we support this bill.
I am Dan Pemberton, representing the Secular Coalition for California, and we support this bill.
David Diskin from Lodi, California, and with the Secular Coalition for California, and I do support this bill.
Tom Ainger, Legislative Chair for Secular Coalition for California, and official supporters of compassion and choices in support.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors in support.
Angelo Niosi, atheist and openly secular citizen, and I strongly support this bill.
Leah Morario, and I strongly support this bill. Erin Hobb, registered nurse. I strongly support this bill. My name is Jan Perez. I live in Senator Japan's district, and I strongly support the bill. Thank you.
My name is Mark Menser. I'm a retired physician. I strongly support this bill.
Francesca Ritano, Senator Pan's district, Sacramento Freethinkers, Atheists, and Non-Believers in Secular Coalition for California. That's a mouthful. Thank you.
I'm Barbara Sislowitz, and on behalf of my aunt who was competent and terminally ill and chose to shoot herself to end her suffering, I support this bill.
My name is Gretchen Brugman from Truckee, California, and I strongly support this bill.
I'm Dr. Paul Corcoran from San Rafael, and I was Chief of Rehabilitation at Spalding Hospital in Boston, and I strongly support this bill.
My name is Anandi Mori. I'm a retired hospice nurse. I'm 81, and I strongly support this bill.
Jeanette Finch, I watched my grandfather die from ALS. I support this bill.
Bob Panzer from Solano County. I support the bill.
Rachel LaForest, I strongly support 128.
Barbara Lemus in Senator Pan's district, and I strongly support this bill.
Joan Bolden, Trinity County, and I strongly support this bill.
I'm Suzanne Smith Hammerly. I'm a retired social worker in Solano County in child abuse and adult abuse and in-home supportive services for adults and the disabled. And I support this bill.
Sandra Graham, and I passionately support this bill.
I'm Tamalon Littlefield, and I'm in Senator Pan's district, and I strongly support this bill.
My name is Susan Radakovitz. I'm a Compassion and Choices volunteer, and I strongly support SB 128. I'm Rosemary Malvey from Half Moon Bay, California, San Mateo County. I've been a hospice worker for 11 years, and I strongly support this bill.
My name is Laura Alster Martin, also from Half Moon Bay. I'm a hospice volunteer for 7 years now, and I strongly support this bill.
Dr. Mary Lorenas, Senior Mental Health Specialist. I strongly support this bill.
Robin Cottrell, hospice volunteer, threshold singer, and I strongly support this bill. Thank you so much.
Lorraine Lombardo, I'm a San Francisco police officer who has been to way too many suicides in my 30 years, and I definitely support this bill. Thank you, Senator.
Maggie Crosby, I'm a senior staff attorney for the American Civil Liberties Union of Northern California, and the ACLU of California supports this bill.
I'm Erin Hansen, and as a hospice nurse here in Sacramento, I strongly support this bill.
Joni Billings, Sacramento. I strongly support this bill.
Dennis Posake. I'm a retired physician from Petaluma, California, and I teach in public health sciences at UC Davis, and this is just an option, voluntary for everyone.
Hi, my name's Debbie Rayburn, and I'm a 2-time cancer patient and a son that was just recently diagnosed with a tumor, and I beg you to please pass this bill. Thank you.
Hi, I'm Kathy Johnson, LCSW, and a medical social worker. I strongly support this bill, SB 128, on behalf of myself and the patients I serve who are chronically ill. Thank you.
Hi, Judy Saint. I represent the thousands of California members of the Freedom From Religion Foundation. We ask you to do good for your fellow man and support this bill, please.
Hi, I'm Cleo Kosel, and I'm speaking for the Humanists of Sun City, Roseville. We strongly support this bill.
Kurt Stahl from Livermore, California. I strongly support this bill. Thank you.
My name is Cruz Maria Stahl. I'm a registered nurse. I have volunteered at a hospice center, and I strongly urge you to vote in favor of this bill. Thank you so much.
Greg Archibald, age 77, from Nevada City, strongly in support of SB 128. Thank you.
My name is Helen Neville. I'm a nurse from Oakland. I don't think starvation is a humane alternative. I'd prefer SB 128.
I am Reverend Dr. Judith O'Neill. I am from Nevada County. I am a spiritual care chaplain with hospice. I strongly ask your support for this bill.
I'm Reverend Dr. Pete Saby. I'm a retired member of the Presbytery of Sacramento, and I'm director of the Interfaith Counseling Service in Davis and Grass Valley. I'm a licensed marriage and family therapist. Strongly, passionately support this bill. And thank you, Lois Woke.
My name is Deborah Reuters Zarco. I'm here for my wife, who needed the support of this bill, who passed away on March 1st. Definitely in support. Thank you.
My name is Lisette Paradis, and I support the bill, and I strongly will do everything to help out.
I'm Mary Kay Q from San Francisco, and I support this bill.
My name is Joy Scott. I'm part of the Stanford University community. My husband was involved with helping his brother employ the Oregon law, and it was extremely difficult, but wonderful to finally have it accomplished.
I'm Deborah DaCosta. I'm in Senator Pan's district. On behalf of grandparents who 45 years ago begged for a solution to get out, and a botched job by my grandfather when he faced terminal illness and we had to deal with the consequences of that, I passionately support this bill.
Latoya Ramsey with the National Association for Social Workers. We are in support.
Raji Prasad from California Psychological Association, and we also support this.
Laura Lunetta from Dr. Pan's district, and I urge you to support this bill.
My name's Catherine Gale. My mother had metastatic lung cancer. She was a psychiatric social worker and a hospice volunteer at the end of her life. Her dying wish was for an Oregon-style bill in California. Thank you.
I'm Karen Gale, Catherine's sister from Dr. Pan's district. Please support this bill.
Dick Colbert from Oakland, California. This is an idea whose time has come. In fact, it's long overdue.
Stephanie Free, Oakland. I represent Goddess Gardens, and I'm also here on behalf of my mother. We have discussed the possibility of oleander if she cannot get something like this. Please pass SB 128.
My name is Chris King from Berkeley, and I'm here on behalf of my mother, who suffered at the end of life, and countless others who have had the same experience.